Now to your health. Recommendations for kids with autism is to start therapy as early as possible. The gold standard is ABA, which can begin as young as 2 years old.
The problem is it sometimes takes until the child is school age to get a diagnosis. Health reporter Haley Hernandez is here to explain how some parents are working around that. Haley.
Yeah, some of the big name pediatric organizations in our area have a 2-year wait list to get a diagnosis. And so if you don't recognize the symptoms until 2 years old, you're not getting diagnosed until 4 years old and therefore missing out on getting treated early. So one local mom has taken the issue into her own hands.
We noticed that she's not talking. She was not comfortable with her peers.
Jawairia Shakil was 18 months old when her family had suspicions she might have autism, but her diagnosis didn't come until 3.5 years old.
The evidence-based therapy for autism is ABA. Insurance will not cover it unless you have an official formal evaluation and diagnosis.
The Shakils decided to start paying a monthly membership at Pediatric Pod Concierge Pediatrics. This style of medicine is attractive for some families because they get same-day and longer appointments, which is helpful for kids like Aisha, who doesn't speak much. And they have direct access to their doctor all the time. Dr. Ida Khanum got certified to diagnose her patients with autism when she noticed the growing need for evaluations.
We know early interventions have way better outcomes.
And then past the initial diagnosis, Shakil says this is helpful for Aisha because they can come back for reevaluations.
For autism, we need every 3 years reevaluation. So if you're not thinking about it maybe a year in advance, you might still not get an appointment in time to get the reevaluation. And if you don't get a reevaluation in time, your insurance coverage might lapse and they would require everything to be done from scratch.
For the evaluation, Dr. Khanum looks at talking, repetitive or restrictive behaviors, not making eye contact, and whether the patient avoids playing with others.
Families can call in and we can schedule them out as early as 2 weeks out. We do not take insurance, so it is out of network, but that's where, the kind of getting them to jump the line, as you might say, or sort of, fast tracking them in.
Aisha is 12 now, and with years of proper evaluations and ABA therapy, she's become more self-sufficient.
She's now able to feed herself after that long of an ABA, so her delays were pretty significant, and the ABA, long-term ABA has helped.
So the average cost of an autism diagnosis can cost up to a couple $1,000s. Dr. Khanum always keeps her cost at around $1,500.
Okay, so Haley, can any primary doctor do the evaluation?
Yes, if they have the right certification, and there are other physician groups in our area who can do this. So you might also be paying out of pocket for them, but you can kind of jump the line a little bit and get a diagnosis faster. So if your goal is to get an evaluation right now, call around, find out if somebody in your area, besides just like the big name hospitals, are doing this kind of evaluation. Yes. You might be surprised.
Check it out and see what's available.
Just don't stay on that wait list.
Yeah, anything's better than waiting, right?
Yeah, I mean, I think when parents have their suspicions, then they start panicking to get the diagnosis as soon as possible.
Yeah.